And the person leading that huge logistical operation is Major General Dany Fortin. Major General, good to see you.
Good to see you. Good morning.
So we're talking to you Sunday morning. You can imagine the question everyone has for you. Can you tell us if we have the vaccines, if they've arrived yet?
The delivery schedule is unfolding exactly as planned. They're on their way. They're going to be here soon, delivered to the points of use. And points of use in the provinces will be in a position to administer those vaccines in the coming days.
Okay, so I'll press a little bit more. Will they be in Canada by tomorrow, would you anticipate?
They start arriving by tomorrow, for sure. Yes.
Okay. Have there been any snags along the way? I know you did a couple of dry runs, but have you encountered any problems so far in terms of getting them here?
No, actually, things are really unfolding according to plan, as I said. In the dry run last week, we identified the transfer points. Transfer points might change. We're closely monitoring with all stakeholders, closely monitoring with Pfizer, BioNTech, and their delivery company, UPS. And we're all on an informed net, and we're closely monitoring this. So it's really going according to plan. So it's all good. We're very happy with that.
Good. What kind of updates are you getting? Just I don't know if you can paint me a bit of a picture. I'm imagining you have a map, and people are giving you sort of hourly updates. Can you give me a sense of what that looks like, or what you're getting?
Pretty much. In fact, we have the National Operations Center here that we stood up a few weeks ago. It's now fully operational at the Public Health Agency. It runs 24/7. It's staffed with both military and civilian counterparts from the agency, and we're closely monitoring several times a day in conversations with UPS. We're tracking their system as well, in conversation with Pfizer, BioNTech, leaning forward into what the scheduled delivery will be in the coming week and weeks. So it's very much an all hands on deck. We're super energized and closely monitoring.
From what you've seen so far, are the provinces ready? Are those 14 distribution sites ready to go?
We're all confident that the provinces are ready. The 14 sites are ready. The provinces have closely monitored this. We've really walked this walk all together in the last several days, closely collaborating, closely coordinating with all stakeholders, provinces, and so on. So we're very happy with where we're at right now. And provinces have confirmed that they're ready at the 14 initial points of use. I should also say that while we're doing this, we're preparing at the provincial level for additional sites. So that's very much the kind of work that we're paying attention to in the coming days.
And how quickly do you think other sites will get stood up then, Major General?
Oh, I think they're ready this week to start activating others, but it will really depend on the schedule of delivery and their capacity at each site. Those sites with freezers and the staff, they can take on quite a significant quantity of vaccines. So they may not be a need initially, but they're leaning forward to activate in the coming days.
How many more sites would be activated in the coming days? Do you have a sense of numbers?
I think it depends per province. They might add 1 or 2 or 3, but when we're at full speed, we're probably going to have a couple of hundred sites for Pfizer BioNTech product.
I know I shouldn't downplay it. We are getting 30,000 doses in this first delivery. How is it going to work going forward? Will it be that number going forward? Do you know when you're getting the next delivery, and how many will be in that delivery?
We're actually very happy to have 30,000 or so to begin with, because it really, really allows us to do the soft launch and adjust as we move forward. The exact schedule of delivery with Pfizer BioNTech is still being worked on for the coming weeks. It's a product that is in high demand around the world. Canada has secured a substantial amount of doses for the first quarter, and we're really now building that schedule with them.
So presumably we would get more in the next delivery than 30,000. Would that be your hope?
It could be another 30,000. It could be more. But really the intent here is to ensure that we continue to have regular drip feed of vaccines in the coming weeks. And we're very much trying to get the optimal schedule of delivery at all levels. So I can't really say more right now about the schedule of delivery, but you can suspect that tomorrow morning and moving forward, that's part of our work.
So let me just end on this, Major General. I realize you're a very decorated soldier, and you've done many accomplished things throughout your career. But how do you feel to do something like this, knowing that what you've been doing over the past few weeks is going to save lives in a very different way than what you did before?
It's super exciting. No one here in the team isn't super thrilled about what he or she is doing. And I have to say, while you see me on camera and you see me as representative of the Canadian Armed Forces effort with the Public Health Agency here, I'm one of many players in this team. I am amazed at the incredible talent, energy, drive, and work that's been undertaken by the people here at the Public Health Agency at Health Canada and various other stakeholders. So I'm super thrilled to see and to be part of this team.
Okay, so I'll expect some sort of update from you tomorrow. Is that fair to say?
I think we'll be pushing information in the coming days.
Okay.
I should say, while we're working on Pfizer-BioNTech scheduled delivery with all stakeholders, we're really paying attention to the next vaccine that is coming online.
Yes.
We expect Moderna to be approved reasonably soon, to be available reasonably soon. And my effort in the coming days with the team is, okay, let's redo what we did this week with Pfizer-BioNTech delivery. We really got to pay attention to being ready with the territories, with the provinces, for points of distribution in those various remote and isolated communities. And in close cooperation with them, we'll ensure the quick delivery.
And when do you expect Moderna will get to Canada? Because it can be pre-delivered, if I understand, before approval.
Well, I'm still working on the assumption that they deliver early January, but I don't want to be ready. I think that would not be prudent planning on our part. So I really want us to be ready at the end of next week.
Okay, and just one more time, Major General, the vaccine's probably arriving overnight and into tomorrow?
That's correct. I mean, there's different flights and transport by truck to various locations. We have the exact schedule, but we're still refining this with, we're monitoring on an hourly basis with UPS. So some flights will arrive tonight, some flights will arrive tomorrow, some trucks will cross the border tomorrow. So they're all coming in the coming day or two.
Okay, Major General Dany Fortin, you're a very busy man. Thank you for making the time for me this morning and for all of us. Appreciate it, sir.
I'm glad to be here. Thank you very much.